The report also mentioned about the reform of public hospitals. Could you give me the top 3 challenges you can see in the reform?
Well, I think the first thing is we have to change the way that hospitals are paid, because the incentives are just wrong. The incentives are moving in a direction that focuses on volume, drug sales. We've got to get the payment system right. Another issue is that there has to be coordination between all levels of the healthcare system. And, a single hospital shouldn't provide primary care, secondary care, tertiary care. And I think the other big issue for the Chinese healthcare system is that you've really got to have a way of making sure that the patient outcome is the most important thing at the end of the day, right? And we're not really following outcomes in a hospital. What we're following is volume, number of patients seen, number of procedures done. And so that shift so that hospitals are held accountable for their outcomes is new. And it's not like every country in the world has done this. There's a group in the UK that simply published the outcome data on all the different hospitals in the United Kingdom. And at first it was very controversial. And some of the hospitals said, well, the reason the deaths are so much higher is because our patients are more complicated. So then they looked at that data and asked the question, are the patients more complicated? And they found out, well, actually that's not true. There's no increase in complexity, you just have a higher death rate, right? So once that all came online, then patients started to be able to see, well, maybe I won't go to that hospital because the death rates are higher there or the complication rates are higher there. I think we have to go in that direction where not only are we focused on outcomes, but we're very transparent about which hospitals are getting good outcomes versus others.